Good afternoon and welcome to We All Use Math Every Day. Today, my special guest is Valerie Rofeberg. Valerie graduated DV in 2010 and went to Brown University and majored in statistics. And now she works as a biostatistician in her dream job at Boston Children's Hospital. Valerie, welcome to our program.
Thank you so much for having me. It's really cool to be part of this.
Oh my gosh, it's really exciting for me to have you here too. I mean, someone who went through room C13, 2 years, right?
Yep.
Now we get to do this way as an interview, and you as a professional, we get to hear about. So, Valerie, as we speak right now, I wish I could say that my students were in C13 watching this interview. They're not, but you know what? I know we've got people who are watching. So, for the sake of those students of mine who would be watching right now, tell us, like, what kind of classes did you take when you were at DV so they can kind of connect with where you were, and what classes were your favorites while you were at DV?
Yeah, so I took the honors track for math and science, and they were by far my favorite classes as well. So I was in like honors geometry, honors biology, all the way up through senior year. Then I was taking more AP classes. So I took like AP Calc BC, AP Physics. I had done AP Bio actually as a 10th grader. And probably, I mean, my favorite classes were always the math and science, particularly Calc and Physics. Stats was definitely up there, AP Stats. But at the time, I think I didn't realize how much I enjoyed it. But we'll come back to that. But also there was a class called Advanced Topics, taught by Mr. Dennis. That was really, it was like the type of math you didn't get in any other math class. It was number theory and number tricks and games and stuff like that, that I always thought was really fascinating, and made me think maybe I wanted to be a mathematician at the time.
Awesome. So then you were already kind of steered in the direction of mathematics when you were coming out of school, and you go on to Brown University at that point. You had some different choices you could make. Tell me, why did you choose Brown University for your college?
Yeah, so it's going to sound strange, but Brown was one of the only colleges that I looked at that had a major called chemical physics, which doesn't sound like it's the math that I wanted to do. But it's basically like particle physics, and I wanted to work at CERN and smash particles into each other and find the Higgs boson, that kind of stuff, because I liked physics so much. So I went to Brown as a math and physics major, and I was hoping to eventually do the chemical physics. And I got there, and I loved it. It was really cool, and I had some cool classes, but college physics is very different from high school physics, and it was really, really hard, and I did not do well my first 3 semesters at Brown. And I got to thinking, what is it about physics that I really enjoy, and what is it about my math classes that I really enjoy? And I met with my academic advisor, and he was really helpful. He brought out this physical book of all of the majors that Brown has ever had in the past, not even current ones. And we just flipped through it together. He was like, what do you like to do? What do you like to think about? And eventually we came upon statistics, which actually wasn't a major at Brown at the time, but it used to be. And so Brown has this thing where if you want to do a major that's not available, you can do an independent concentration. And you have to submit a proposal with the courses that you'll take, reading that you'll do, types of projects you do. There was an endstone or a capstone project that I had to do. And so that's what I chose to do, because I realized what I really liked about physics was the mathematical application to the real world, and it wasn't necessarily the physics itself. And what I liked about math was seeing how I could use the things I was learning in class. And so stats just really made sense, especially when I thought back to high school and it's like, wow, I really did enjoy my AP stats class. Like, I sort of had forgotten about that because it was an AP class that I didn't get credit for, but like, it was just on my resume. But looking back, it was really great. It sort of came naturally to me. It felt right. So that's what I did. So I got the independent concentration in statistics. And the way Brown had the stats major set up was that you could do econometrics, which is more stats applied to like the economy and GDP and all that kind of stuff. Or you could do this thing called biostatistics. And I didn't really know what that was, but there were a lot of classes in like the public health department and on the biology side. And I thought that sounded much cooler because I've always sort of been interested in healthcare anyway. So I did that. And then Brown also has this cool thing called a 5th year master's. And you can stay for 1 extra year and get a master's degree if you start taking those graduate classes as an undergrad. So I signed up for that as well. It ended up taking me 2 years anyway. It's very hard. I actually ended up getting an RA-ship or an internship as my first year grad student, and that took up so much time. I just needed the full 2 years to actually complete the master's degree. So then I ended up getting my master's in biostatistics as well. And that was sort of the trajectory. I went from chemical physics to biostats, and I couldn't be happier about it.
Good. You talked about like some of the classes that you took in kind of chronological order. AP statistics for you was a 10th grade AP class. Isn't that correct?
No, I think I took that senior year.
Oh, did you really?
Okay. Maybe junior year. Might have been junior.
Yeah, I don't think it was senior for you, but
junior.
All right, good. So let's go on. Then you're a student at Brown, and while you're at Brown, like a lot of places require you to do an internship. So did you have to do some sort of internship at Brown? And tell us, like, what kind of work would be involved in an internship like that for you?
Yeah, so I got that internship, I think it was October. I think I started October 1st of my first year of grad school. And I was working in something that was then called the Center for Evidence-Based Medicine. It's now called the Center for Evidence Synthesis in Health. The whole thing about the name change. But basically what we do, evidence-based medicine is the idea that doctors will base their practice on the abundance of medical literature and the evidence that we have that certain therapies work, certain therapies have these types of side effects, interactions with each other, stuff like that. So what we did in that center was we would come up with a project. Generally, we were funded by the NIH, and they would put out calls for proposals, and they would say, we want somebody to look at omega-3 fatty acids and whether or not they actually help your heart, so cardiovascular health. And so we would bid on those projects, and our center would get some of them. And so that was one of the ones I worked at. And we did a thing called systematic reviews. So we would search as much of the entire medical literature as we could possibly search. We would get back tens of thousands of abstracts that could potentially be relevant to this topic. We would read those abstracts, screen through them, and based on certain keywords and what we knew about the project that we were going to do, we would pull out the papers that we thought were relevant. Then we would read those full papers and exclude a whole bunch at that stage as well that we thought might be relevant based on their abstract, but didn't actually relate to this question. Then we would take all of those papers, pull out the data that we needed. So if like it would be like a typical randomized clinical trial, right? So a bunch of people got omega-3 fatty acid, a bunch of people got placebo. This group of people had this blood pressure, other group had a different blood pressure. What's the difference? Does this drug actually work? And so there are a whole bunch of studies that do that. And so now we have an answer from here that say omega-3 fatty acids lower your blood pressure by 5. And then this study says 3. And this study says, well, actually they raise your blood pressure. So definitely don't use them. And so we would take what's essentially a weighted average. It's called meta-analysis. We would take an average of all of those studies and put together, I think it was a 1,300-page report about omega-3 fatty acids that we would then hope that doctors would read and make an informed decision on whether or not we should actually be prescribing or suggesting or recommending omega-3 fatty acids for these certain conditions. So it was a lot of that. I didn't know anything about meta-analysis when I got the position, and I learned it on the job. I also didn't learn it in any classes. So it's a type of statistics that's very specialized. It's very niche. Not a lot of people do it. And so my boss basically taught me how to do meta-analysis, taught me the software for it, taught me the theory behind it. And then I was able to do it. And I actually stayed at that job after graduation. It was my full-time job for a couple of years after graduating.
How hard was it to get a job at Brown while you were a student there?
So my experience, I think, is probably not typical, but I'll go through it anyway. So because I started taking graduate level courses as an undergrad to try and work towards this 5th-year master's, I got to know some of the professors earlier than any of the first-year master's students coming to the school, like joining Brown as a grad student. And it just turned out that a professor I had already taken a class with was the one hiring for this position in the Center for Evidence-Based Medicine. And so I knew him personally. He knew what I was capable of in terms of my statistical background because he had had me in class. And so a bunch of first-year students interviewed for that position, but I think I probably had a leg up because I knew him and he was able to glean more than just an interview in terms of what I could do. So I think that helped a lot. A lot of master's programs want an internship, but they're not necessarily guaranteed. So like Brown encourages internships and RAships, but they won't do any help to help you find one. You basically have to go out and do that yourself. So I know a lot of students struggled with that because you basically have to approach somebody and say, I want to work for you. And you have to hope that they're interested in you and you're interested in their research. So I definitely got really lucky with that match. I got lucky that I enjoyed that type of work, knowing nothing about it going in. But yeah, I think as a piece of advice, getting to know a professor on a personal level, like take a couple classes with them or at least take one class with them, then approach them to start working with them can really, really help.
Awesome. Thank you. There is a question that is kind of a burning question that has to come up at some point. Now is the time. So the word biostatistics has come up multiple times, and it's one that gets a lot of questions. And as you well know, biology and statistics are two big classes for the math science students at DV to take, and sometimes close together with each other. So as you call yourself a biostatistician, what exactly is biostatistics? I mean, is it biology? Is it statistics? Is it some kind of merge of the two? And if so, is it more bio or is it more stats? What's biostatistics?
That's a really good question. And so basically, the short answer is that it's statistics. I don't really have much of a background in biology, but all of my training's in mathematics and statistics. But in just about every class I took and all of the work that I have done has been statistics specifically applied to public health and medicine. So it's not necessarily biology like you'd think of like plants or animals or ecology. It's more, do drugs work? Do combinations of therapies work? How do diseases spread? That's a little bit more epidemiology, but epidemiology and biostatistics are pretty closely related. But basically, it's statistics applied to public health and medicine. And so examples in class were always in the context of a public health question or a drug therapy or a research study looking at those types of outcomes. And then homeworks for class, projects for class, and then the types of jobs you get with a biostats degree are generally in the public health field. So hospitals, industry, like the pharmaceutical industry is a big one. Government jobs like the NIH or the FDA, they're all looking for biostatisticians. And it's not that you have a biology background or a medicine background, it's that you just think in terms of clinical trials or you think in terms of retrospective studies or prospective studies like that.
Okay, great. I want to ask you a little bit about Boston Children's Hospital in a second, but first, just to remind the people who are in the audience in YouTube Live, you can also pose questions to Valerie by posting them as a comment in the live chat, and I will see them as they come up. And if it's one that fits in well, I'll just throw it in. But right now, let's move on to what I really want to get to too, because I still remember when you told me that I thought it was more times than one, but that you told me that Boston Children's Hospital was your dream job. And it's what a beautiful phrase when someone comes back, a fast student says, I've got my dream job. So tell me, what is it about Boston Children's Hospital that makes this for you, Valerie, your dream job?
You know, now that you said that, I've been thinking about it. And I think I said it in my interview at Children's. They asked like why I was interested. And I think I used the phrase dream job when I was talking to the people who eventually hired me. So basically, when I decided to do biostatistics, I kind of pictured myself eventually working in a hospital. I knew that I probably didn't want to work in the pharmaceutical industry, and they're probably the biggest hirer of biostatisticians. I tried working in academia at Brown, and it was great, and I enjoyed that job. But one of the things that I wasn't getting out of that meta-analysis systematic review position was that I couldn't see the impact of what I was doing. So we put out these 1,200, 1,300 page reports, and we hope doctors read them, and we hope they change their practice based on that. But there was no feedback loop where we were hearing, wow, this report really had an impact on anybody, really. And so working in a hospital, working on clinical trials or working on registry studies in a hospital setting, working with the doctors who are actually treating patients was really, really appealing, because if they give me two scenarios and I give them back the stats that say this works better than this, I know that they're going to change what they're doing to do the thing that works better. And it's absolutely amazing. One of the things I love about working at Children's is that I get to work with psychologists, cardiologists. I'm actually in the Department of Cardiology specifically. So I work with cardiologists, psychologists, I work with neurologists, I work with other statisticians. And it's just this huge diverse team that everybody's bringing a different perspective, and we can come together and create a study and that is meaningful to each of those people. Mm. So we're there to tell them, how are you actually going to measure that outcome? Maybe that one doesn't make sense. And then the neurologist is there to say, well, we can't measure it that way physically. We can't look at that part of the brain, or we can't get there. And then the psychologist says, well, even if you tell us that this is the outcome, that doesn't matter to us as a psychologist. We need to know this about the child. And so it's all of these different pieces that can come together and really make a worthwhile, meaningful research study that will have direct impact on the kids and help them. And it's really, really cool. And it's just, I love it. I absolutely love it.
Awesome. I mean, you could see just on your face how much you love it when you talk about it, which is a great thing to see. For our students, if they never ask me what it's like to be a teacher, because they see what a teacher does, or they think they see what a teacher does and what the work of a teacher is like without seeing the behind the scenes type thing. But, you kind of talked about some of the things that get you excited about your job. But if you could talk about what is like a day in the life of Valerie Rofeberg, like someone who works at her dream job at Boston Children's Hospital, what kind of things do you do, I guess, from day to day? What does a day in the life of your work look like?
It's a lot of computer programming, actually. So when you learn, like in AP stats or in most high school math classes and even college math classes, you're learning the theory behind what you're doing. And to do that, it's often, it makes sense to learn how to do everything by hand, right? Like if you want to know a standard deviation, you will add up those numbers and you will subtract from the mean and you will square it and you will divide. And it's like, there are computer programs that do that for you at this point. So you don't have to do like a t-test by hand. I do t-tests all day long, but it's a lot of computer programming to make sure that I'm looking at the right set of patients in our database, and doing a t-test and then storing it in the right place and then putting it into a table and then presenting it in the right way, getting confidence intervals, getting standard errors, standard deviations. So a lot of computer programming, but that's generally what I'm doing if I'm at my desk. I am like running analyses. I am crunching numbers. But it's so much more than that, because we have these meetings where we get to sit down with the doctors and we get to sit down like with people who are seeing the patients in our studies, and we talk about what we want the study to look like. I've been involved in like study design, which is really cool, and coming up with outcomes and coming up with not necessarily interventions, because I'm not a doctor, but just like discussing the interventions. Are they feasible? Determining sample size. So sample size calculations is a big part of it. If someone wants to do a study, I want to make sure that they have enough people in that study to actually detect a meaningful difference in the outcome, right? So I do a lot of sample size calculations. Talking about like how the study will go, how long it will progress, what our outcome is, and is it like an immediate test that we can do with the child when they're right in front of us, or do we have to follow them up for a while and hope that they come back for a second test? It's a big part of it. If they're not coming back, what do we do? Do we try and recruit more patients, or do we just go with what we have and then say our sample size is not very good? So a lot of those discussions. And then what's really cool is once we have an analysis at the end of a project, when the data gets to me and I do some data cleaning, data manipulation to get it into a usable data set, because data is never clean, it's never pretty, never comes in the format you want it. Mm-hmm. I get to run some analyses, bring it back to that group of investigators and say, this is what we found. Does it make sense? If it doesn't make sense, we have to figure out why the results we got are not what we expected. And then we have to consider, well, are there confounders? Are there other variables at play here that maybe we didn't measure and then we can never know how much they're impacting it? Or maybe we did measure it because we thought just maybe this is affecting something. And then I have to go back and I rerun everything, and then we adjust for some things that maybe we didn't consider adjusting for before. And it's a very iterative back and forth process between me, just like they always see it as just like pushing the button to get them the new analyses, and then them discussing whether or not this makes sense. Can we explain this? And if not, then we have to try something else and see how do we explain what we just got. And it's just really cool. And like, when I give them something that makes sense and like they kind of expected, but they didn't have the evidence for, you can see how excited they get. And they're like, I knew it. It's so good. And then they're changing their practice based on what we find. And like, they know all of the kids in our database. And so I'll say, I think I have an outlier. This one child was in the hospital for like 200 days right after their surgery. Like, do we think this is a typo? They'll be like, no, I know who that is. That's not a typo. It's really, really cool to see how invested they are in the families and the kids.
Beautiful.
And just, it's amazing. Everything about it's amazing.
Yeah. Valerie, we actually have a couple questions from the audience, and one of them fits like a glove right now in what you're talking about. So let me bring this one up. Michaela Courtwright, AP Stats student, current AP Stats student, asks, what is one of your favorite cases or studies that you have worked on at the hospital? Could you single in on one and tell us about it?
Oh, I absolutely can. And this research is not published yet. We're almost there. We've submitted the manuscript, but it's really, really exciting. So we can take pictures of baby brains when they're still in the mother's womb. So it's called a fetal MRI, and we can take an MRI and like measure the brain volume and the volume even of specific regions of the brain before they're even born. And so we were able to do this. I'm saying we, I had no part in this. We were able to do this for kids who have congenital heart disease. So we know that they have heart defects before they're born. And then kids who are seemingly healthy, at least in terms of their heart. And so we measured the brain volumes before they were born. And then we have so far followed them for 2 years after they've been born. And now we're looking at, it's called neurodevelopmental outcomes. So things like their memory, their processing speed, how well are they sleeping, different things like that. And we can see, does the size of your brain before you're born affect how well you do, almost like how well you're doing in school, how well you're doing developmentally 2 years down the line. And we're putting in, hopefully we're going to be able to follow these kids for even longer and see how they're doing at 6 years old or 8 years old. And it just blows my mind that we can get that type of information so early on in a child's life. And if we realize that there are differences in brain volume, then maybe we can propose an intervention before the child's even born to try and help that brain volume develop a little bit better. So put the mom on oxygen or reduce stress, things like that. And we can start intervening before children are born to try and help their outcomes 2 years down the line. So that has been really, really cool. I didn't even know this technology existed before I started working there. And I think that's definitely, it's a very complicated analysis and it's tricky. And there are a whole bunch of things that go into both brain volume and neurodevelopmental like ability at 2 years old. And so trying to manage all of those variables and account for everything that we can possibly account for in our analysis to make sure that we're getting the right answer and the right effect of brain volume on the outcome has been difficult and challenging. And I've absolutely loved it. So that's probably one of my favorite projects so far.
We're actually just got a question from the audience as well that maybe overlaps a bit with what you were just talking about to that first one. So Katie Sherman asks, how does your job affect daily life? For example, an architect would probably look at buildings around them and think about how they would design it differently. So how does your job affect daily life?
So much. Part of it is that I think the biggest way it affects my daily life is not necessarily the biostatistics side of what I do, but just the statistical training that I have. So whenever I read a news article that cites a study, or whenever I read even a medical article for something for work, I am constantly criticizing all of the methods that they've used and trying to determine if I believe the source is reliable. So if I see, oh, a study just came out that chocolate improves your health, like, well, does it though? And then I see that the study was done in 10 people and they have all these other conditions going on. And so like I can determine better if I trust a source or not. And people like my friends know that I do this, and I have training actually in like bias assessment of articles because that was part of my job at Brown. They send me things often and say like, do you think this study's reliable? Do you think their methodology was good? Do you trust their stats? And then as to the best of my ability, because obviously a news article is not going to report all the details, but I will try and find the report of that study, like the original primary paper from that study, and see, do I agree with their methods and how do I think they could have done it better? And I'm just constantly thinking that way and constantly not trusting anybody's statistics on anything. Yeah. So it's a blessing and a curse, but it certainly affects my life every single day.
Okay. Actually, I'm going to take a third question from the audience here right now that I was thinking about saving till later. But Gabby Courtwright asks, has your job been impacted in any way by the current pandemic? And I know that you saw our previous program 2 days ago, somebody who was definitely affected by COVID-19. So how has your job been impacted, if at all, by the current pandemic?
On a basic level, I've been working from home since March. So normally I actually live in Providence and I commute up to Boston every single day on the train. And so I was one of the first people that said, I don't want to be on the train every day. I did not feel safe doing that. I didn't have a mask at that point, so I really didn't want to do that. So I stopped commuting, been working from home entirely. But in terms of like the work that I do, there are a few different things at play. So I think generally it's understood that kids, like obviously I work at a children's hospital, so kids are not necessarily getting as sick as older adults, even if they do get COVID. So we have cases at Children's. I think we have, I don't want to make up a number. We definitely have seen cases at Children's. Obviously, I don't see patients, so I haven't been worried about my health or anything like that. But there is a lot of research being done on coronavirus in kids. So far, I haven't been on any of those studies, but I know that people I work with are in the process of proposing them. So we can study, again, I'm in cardiology. So how does it affect kids who already have health issues in terms of their heart? So congenital heart disease, like they were born with it, or heart injury later on. And then also potentially, how does it affect their neurodevelopmental outcomes? So if we can start to follow kids now who have had COVID and recovered, is it going to affect long-term their development down the line? So I haven't personally been on those studies yet, but I know they're in the process of being proposed, and I think potentially I will get to work on some of them, but not yet.
Okay. You alluded to this a few times that you're working at Boston Children's Hospital, but you don't have a medical background. And you talked about even that biology wasn't one of your top choice classes when you were in school and that sort of thing. So how does that impact you getting the job where you are now? I mean, does that work against you at all at this point, or was it tougher to get the job, do you suspect, because of lack of a medical background?
So I don't think it helped, but I also don't think it hurt. So I was applying for a biostatistician position, and obviously, like, it would be ideal if I had background, like I had worked at a previous hospital or something like that. But they don't expect it. They know that most of the job is statistics, and they expect you to learn about the conditions that you're working on and the outcomes that you're working on the job. So when I first started, I got a ton of articles to read about previous studies they had done on kids with congenital heart disease. I had to learn about the neurodevelopmental outcomes and tests that we use to determine how the kids are doing. And so at this point, I think I could tell you some basics about the different types of heart conditions. I can tell you how some of the assessments are done that we use as outcomes. I can tell you pretty generally what affects both. So what we think, like, the heart having the heart condition affects in terms of like a mediation analysis, and then those things go on to affect their development. But I was not expected to have background in cardiology or psychology or neurology or anything like that. The fact that I had worked on a couple projects at Brown that dealt with cardiovascular health, so that omega-3 study, I also worked on another one with mitral valve repair. They really liked that because they knew that I at least had some inkling of what outcomes might look like. But it definitely didn't hurt me that I didn't have a strong biology background, because most of what I do is statistics and not biology.
It's neat, I'm sure, for our kids to hear that, you know, with a statistics background, that they can link that to so many other fields, even if they're not a super specialist in those fields. So that's great. Valerie, you've already kind of told us how much you love what you do, but like if someone asked you just like, why do you love what you do now, and what kind of research do you do now?
I think part of what I love sort of puts it in contrast with what I was doing at Brown. So at Brown, I was doing meta-analysis and I was doing systematic review research. And it was statistics, but I didn't feel like a biostatistician. I didn't feel like I was using everything I had learned in my classes at my job. I was doing this one type of analysis, but I didn't even learn that in class. I learned that at work. And at Children's, I get to use what I have learned in my classes every single day. Like I am sitting there doing t-tests and interpreting t-tests, and I am running regressions and interpreting those regressions. And I get to do all sorts of things where I'm looking at like diagnostic tests and determining whether they are sensitive and can identify false positives or false negatives, or like true positives, true negatives, every single day at work. And it's just like seeing the application of what I have learned in practice and drawing on those theories and applying them. And like, I know we always talked in AP stats about like, what are the conditions? Like you have to assume normality, you have to assume a large sample size, you have to check all these assumptions before you can actually do a statistical test, right? And I'm checking those assumptions at work. And sometimes I can't do the test I wanted to do because those assumptions are violated all the time. And so I have to find a new method. I have to go to something non-parametric. I have to not assume normality. And it's just really, really fun to solve these little puzzles every single day and then apply them to something that I know is going to help people down the road.
Some of the beauty and the joy of statistic classes that some of my students hopefully will be taking well after AP Stats is over. That's cool that you alluded to some of that. But let's stick with AP Stat curriculum for just a second. So think about, as best you can, the different things that you learned while you're in AP Stat. Like we have a number of students in the audience that are AP Stat students. I know 2 of the questions already have come from current AP Stat students this year. And so they've essentially finished the AP Stat curriculum. They have experience with studies and all kinds of different inference procedures. What kind of procedures that they may have heard of? If you think that maybe they did that, you're not sure, that's fine. Just talk about what kind of things that they learned in AP statistics while in high school are the most common ones that come up in your work as a biostatistician at Boston Children's Hospital.
Yeah, so I'll just think through basically the progress of a research paper. So to start, we'll generally have what we would call a table 1. And that's just got all the demographics and descriptive statistics about the people in our study. So what does our population look like? And so for that, it's generally very basic. It's like means, standard deviations, medians, interquartile ranges, percentages, just the most basic stuff just to characterize the population. If we have a study that has 2 groups, so say an intervention and a control, or like a CHD group and a healthy group, healthy, then what we'll want to do at the beginning of a study is see, is our like intervention group similar enough to the control group that we can say the only difference between them is the thing we're interested in, and now we can start to hint at causality. Because if they're different to begin with and then they have different outcomes, you could say, well, that group was older, so maybe that's why they had different outcomes. And that group was sicker, so maybe that's why they have different outcomes. But so what we want to do is check the assumption that the groups are pretty similar to start with. And then we can say the only difference is the presence of congenital heart disease or the presence of this intervention. And that's what's causing a difference in our outcome. And so to do that, it's generally t-tests. Almost never z-tests because it's hard to get a large enough sample size for it. It's almost never normal. And so we generally stick with t-tests. Sometimes we even do non-parametric tests, which I don't remember if we do like rank sum tests or anything like that. Where it's basically like, I don't know that I need to explain what a rank sum test is, but like you're looking at everybody in this group and you order them. Then you look at everybody in this group and you order them, and you see like, are these people, if you were to order everybody at once, are most of these people higher ranked or lower ranked than the other group? And if most of one group is higher ranked than the other group, they're probably not the same. And you don't even have to assume anything about the distribution of the entire group to do a test like that. So we do a lot of those because we just have small sample size and non-normality. So a lot of those, just comparison of two proportions to see if they're the same, very basic stuff like that. Then we'll start to get into analysis of the outcomes. So oftentimes it's regression, which is like putting a best fit line to your data, seeing how much the points vary around that line, right? And then usually it's not just one predictor and one outcome. We often have one main predictor that we're interested in the effect of, but we have all of these other things that also might be influencing the outcome. And so we have to adjust for them. So those also go into the regression, and we look at the effect of each of those covariates on the outcome. And so sometimes we will have a list of like maybe 10 things that we think are affecting the outcome. And that's a lot to put into a regression, especially if you have a small sample size. You don't want to be adjusting for too many things because you're losing degrees of freedom every single time you put a new variable into it. So we do something called stepwise regression, where everything goes into the model at first and you see how well your model does. And then you start to take some variables out, or you put some variables back in, and you see, it's called model building. It's how do we get the best model to fit our data and predict the outcome without overfitting our data, because we don't want to predict everybody perfectly, right? That doesn't help us for future patients because they're not going to look exactly like our patients now. So we want a more general model. And so it's a lot of that stepwise regression as well. We do a lot of ANOVA, analysis of variance, to see if we have more than one group, is one of those groups different than the other groups? Especially if we have like a dose study, we'll do, it's called ordered regression. So the outcome isn't always just continuous. Sometimes they're one of three categories, like severe, mild, perfectly fine, something like that. So there are different types of regression that aren't just for continuous outcomes. There's something called logistic regression that deals with a binary outcome, so this or that. A lot of logistic regressions as well. I think those are the most common types of analyses I've done. I've also done something called propensity score matching, which is really fun. Definitely not on the AP test or in the AP curriculum. But basically what you're trying to do is if you have two groups of patients that you know are not the same, but you still want to be able to compare them, you will find a person in the intervention group and a person in the control group that look most like each other. And then you essentially do like a paired t-test, but comparing those matches that you found. And so you have to find a way to match them and find the ideal matching. And that's where the more complicated stats comes in. But that's another type of analysis that we do a decent amount.
Well, you hit on a lot of things in there. And the challenge for you, I'm sure, it's been like 12 years since you took AP statistics, is what you learned then and what you learned later. And the neat thing about statistics, for the sake of my students in the audience, is that once you learn what's in AP statistics, you're so well set up to transition to learn new statistics after that. So when she talked about non-parametric tests in there, and what are some other things that you mentioned, rank sum tests. I mean, learning those things is a real natural. ANOVA would have been real easy if we had just a little bit more time before COVID hit us, that our students would have been learning more of in class. But yeah, that was great. So thank you for that answer. We have a couple more coming from the audience. In fact, I'm going to get this question in here now. This is Michaela asking another question here on this. Have you seen any firsthand impact of one of your studies?
So I haven't. I just started working there 2 years ago, a little less than 2 years ago. And so it takes a long time to get a research study published and out there. And so I don't actually have any papers yet coming out of Boston Children's Hospital for my work there. I do know that when the doctors I work with see the analyses, I know that it's always in the back of their mind, even if that research isn't published. But I have not yet seen any impact from my work at Children's. I have seen studies from my work at Brown get published and get picked up by decent sized newspapers and advertised about, there was one about renal failure, so your kidneys, and whether stents help or surgeries help or medication helps. So we had a paper about that get out, and it got pretty wide press coverage. I don't know that there was any impact from it. I haven't heard from doctors about whether they changed what they're prescribing for renal stenosis, it's called, when you get a blockage in that renal artery. So I haven't yet, but I trust that it's coming.
Okay. Another question from the audience here. Katie asked this question. Is there any fancy equipment or software that you use in your statistical analysis in Boston Children's Hospital?
Yeah, that's actually a really good question. So I mostly use a program called R. It's a software program that mostly works based on vectors and matrices. And so like all of our data is in a big matrix, and then we do matrix algebra to apply functions to it. It's simpler than that. That's just the best way to explain it. It's more intuitive than that. But that's the coding language that I use most. A lot of people use a program called SAS to do analyses. I think industry mostly uses SAS. Some people that I work with use SAS as well. There's also SPSS. It's a lot of acronyms and letters and everything. But yeah, there are a whole bunch of different softwares that you can use to do these types of analyses. I just learned R in school, and so that's what I have been most comfortable with.
Valerie, actually, let me follow up that question for them too. I'm wondering, given that you talked about programming in R and that sort of thing that you kind of referred to, would you say that for a current student in high school that's taking statistics, loves it, and thinks that maybe they might see a career path similar to what you are doing there, is computer science an important thing that they might want to be taking while they're in high school? What do you think?
I think probably yes. I never took a computer science class specifically. I took some classes that were described as computing, but it was all in the context of statistical computing. So I assume that learning something like Java or HTML or a different program, I don't know any of them personally, but I assume that would be really helpful because a lot of it is logic, right? And loops, and like, I need my program to do this in this order, and knowing how to just think like that is really, really helpful. So I would say if you have the opportunity to take a computer science class and you're interested in statistics, I think it can't hurt you. I think it would help you.
This is going to be a really good follow-up to that then. If you were programming in R to be able to do the studies that you want to do, the work that you want to do with R, then, but you didn't have any computer science background coming out of high school, is that something you took somewhere else, picked it up, or were you just able to pick that up easily in the context of your statistical analysis with R?
So kind of a combination. So in undergraduate, I learned a program called MATLAB, which is even more all about the matrices, as the name might suggest. And I took a class, it was an applied math class, but it was basically supposed to teach us MATLAB. So we learned a bit of the coding in that class, but mostly it was like, this is the theory, this is what I want you to program, go home and figure it out. And that was a lot of how I learned then R. R was similar enough to MATLAB that I picked it up a little bit faster, but a lot of it was like professors saying, you have to solve this, use whatever software you want, you're on your own. So I learned a lot of it on my own. R has really good, it's open source. And so if you are trying to do something in R, like you want to run a linear regression in R and you don't know how, you just Google linear regression in R and there will be 100 examples for you to follow the syntax and know how to program that with your variables. So it was definitely easier to learn R, I think, than some of the other ones, but I was never taught that formally in a class, no.
Okay. One of the questions that came from the audience, I think is going to make you smile. It made me smile when it came up here. Do you still use a TI-84?
Oh man, you know what? I would, but I lost mine and it's horrible. I know, I'm really sad about it. I absolutely would. It would be wonderful, but yeah, I miss it. I really miss it.
I'm glad she asked that. I would have never guessed in a million years you would have said yes to that question, huh? You still use it? You would still use a TI-84?
I would. Oh yeah, I absolutely would. Because like, if I'm doing something in R, so I wouldn't use the TI-84 to do a t-test probably. I wouldn't enter it. I wouldn't want to enter in all of my numbers that way. But I would use it for like as a regular calculator, I think. But I think for the nostalgia factor, that's probably mostly why I would use it.
I'll tell you what, Valerie, when this COVID stuff is over, you're going to come back and visit. And I have this right here for you. Okay.
Oh
so that's right. And I have something else, actually, I'm going to show you. Probably I have to remember this now to show this to you at the end of the interview that you'll find to be rather nostalgic as well. But I have that for you. And all you have to do is bring me dark chocolate.
Okay, I'm in.
Good. All right. Sweet. Let's go on. I have another question in here from the audience. And then one more I think I want to ask you myself. And that's this. You mentioned some programs that you use. You mentioned R and that sort of thing. And the young lady who's asking this question also has an interest in computer science and is taking that. So if you could speak as best you can to this question, what language is used and so on.
Yeah, so each of the programs that I mentioned have their own language, basically. So there is syntax that is specific to R itself. It's not another computer programming language. But I think if you knew another language, you would be able to pick up R, probably the easiest of the ones that I've mentioned. Yeah, I mean, it's tough to explain. It's just its own language, really.
Okay, all right, great. Let's bring this right back to the students at DV, and this is going to be a good one, I think, to possibly end on. If you had to give advice now to the Valerie Langberg that was at Delaware Valley High School, and give actually advice to the current students that we have who might be watching it after this is over too, okay? What advice would you give to a DV student taking math courses and enjoying them, but sometimes enjoying math courses doesn't equate to knowing what you want to do with math? Yeah. So what would you tell them that if they know they like their math courses, but they just don't know what they want to do with it?
Yeah, I wish someone had told me this earlier, but I think really the biggest thing is think about, and it's hard to do, and it's hard to put a finger on, but think about what it is about math that you enjoy doing. Is it the numbers themselves? Is it figuring out a proof? Or is it the application that you can see that having to the real world? And if it's the application side of it, application to what? So is it that there's math and computer science and really you're liking the computer science? Is it the stats, like you enjoy doing the stats, but is it because you like healthcare and the applications it can have in a hospital? Or is it that you like econometrics and you are also enjoying your econ class maybe? Or is it the application of math to physics? Because like, I think it's going to sound cheesy, but math applies to everything in the real world. And so if you can figure out what application it is that you're really passionate about, I think combining the two is really where it's at. Because I mean, I'm not a mathematician. I think being a pure mathematician is a lot different than doing math where you can see what you're doing with it. You can see what the impact is, and you can see how to apply it to, like, when am I going to use this? Well, you could see when you're using it based on those other classes. So I think just thinking like within yourself, what it is you really like about math. Is it just that it comes easy to you? Is it just that you like following an algorithm and taking step by step by step and getting a right answer, which is fine. Think about a career that maybe would follow the same path. Yeah, I think it's all, I'm biased because I'm an applied mathematician, but
Right.
I think finding that application that really speaks to you is a great way to use the math that you love, but not necessarily be a mathematician.
Okay, great. Valerie, we're not done yet, but I do want to make a little plug here for those who will be coming back and watching more programs. So on Tuesday, actually Tuesday and Thursday next week, we have 2 more interviews with DV alumni who are doing very interesting things in mathematics. So on Tuesday coming up, June 9th, we'll be live with Drake Eshelman, who graduated from Cornell, just graduated from Cornell days ago. He'll be discussing math and music. He didn't graduate with a degree in math. He's math adept, but he graduated with a major in music. He likes to write programmatic music for things like video games and other things like that. And he has some really interesting things to talk about applying math to music theory. And so for my students who were just learning in a Zoom room about the golden ratio, that's going to figure into this. That'll be cool. And then on Thursday, Greg Giliberti, who graduated from DV in 2015, is going to be interviewed. He is now, he graduated from Penn State in statistics, and he went to work for Disney for a period of time. What does Disney need with a statistician? Where do you hear that? But he's now a consultant. The life of a statistical consultant is kind of an interesting one. Okay, Valerie, I said I wasn't done with you, and I'm totally breaking out of my plan here, but I can't resist this. Hang on just a second here. It's meant to be. It was the first one I pulled off the shelf. So Valerie, you know that this is my last year at DV, and basically I was in my room starting to clean out, pull some books out, stuff like that. And I don't know if you remember using this book.
Oh my gosh.
But I want to show you, it's not just that this book is in my hand right now. I somehow accidentally opened it up. I'm serious. And I just want you to look at what it says. See if I can get that there. Can you see that?
That's so funny.
So this is a permanent part of the Divisia library right now. So if you come back and visit, I'll give you this. And I'm keeping this, though. Okay?
Please. Look, it's in such good condition.
It's amazingly good condition. Did you use it at all, Valerie?
Well, I don't know.
Answer that. So anyway, I guess it worked out fine for you, didn't it?
Yeah,
so,
it did.
Anyway, guys, my special guest today was Valerie Rofeberg, and did a fantastic job with this interview. It was so much fun. It's always fun to talk with you. We spent more time talking outside the interview than in the interview. So, and obviously, like all the other people we're going to be interviewing, she loves what she does. She's enthusiastic about it and has great examples to share about how if you love what you do, you never have to work a day again. So you can do this, and you can use math in what you do all the time. Folks, thanks for visiting. This program that's live right now is going to be up on YouTube at this very same link for other people to watch as well, so you can steer them in that direction. Thanks so much, Val, for being here.
Thank you for having me. This was fun.
Absolutely. We all use math every day. Have a great day, everybody.